Good evening, ladies and gentlemen, and welcome to the Stephanie Stevens Show and Pronoun TV. Today on the show, I have Mr. Chadwick Chung and Mr. Chad Conley. We're just going to have a friendly and open discussion today about COVID-19 vaccine that we want to just have an open conversation about should the LGBT two-spirit pronoun community take the vaccine, who gets the vaccine first, and what do we actually think of the vaccine? And do we think we should take the vaccine or who should take it? And we're going to have that conversation today on the show, just so we can just let you guys know that we are in tune with what's happening with our community and the overall sense of, is the vaccine safe? And should we take it? So today, welcome to the show. How you guys doing?
Good, Stephanie. How are you? Merry Christmas. I see you got that tree in the back, and I see your makeup's on point, girl. You're looking good for 32 years old.
Oh, thank you, darling. You know I'm doing my thing.
You just made her younger than me.
Oh, yes. I have to bring a little bit of bloom to the scene because you boys don't, y'all wait to the last minute to do anything. But
what do you mean? I was gonna attempt to shave. As we all know, I got held up. I apologize for being late. I didn't have time to shave and get myself usually ready. My roommate is working from home today, so I'm trapped in my bedroom to do this. So I'm laying comfortably on my bed. This is gonna be a wonderful discussion.
This is great. I mean, I want you to be comfortable because I want us to have the discussion today about the vaccine because it seems to be on everybody's mind, and mainly now that the numbers are growing and even in Toronto the numbers are growing and in different cities. And for some reason I want to ask you this, Chad, how is it that people are taking the test and they know these numbers, or how are they getting these numbers? Is this virus airborne?
So first off, when they first started to come out with the test, they brought the tests out. They were only testing people who were experiencing symptoms. So that was during the first wave of COVID. Mm-hmm. Then they started to open it up. And so anybody who had a little sniffle, anybody who had anything, these numbers are extremely skewed because if you have a cold, you will test positive for COVID, certain strains of colds or certain strains of flus. So I don't want to say that it's not an issue. It is. Like I said the other day in another podcast, if that vaccine was cooked down to powder and made into ketamine, all the gays would take it. We would have herd immunity by Sunday. Mm-hmm. So, the thing is here's another thing, is Pfizer is the one that everybody is complaining the most about of producing this vaccine. But 15 years ago, when Pfizer first came out with Viagra, not one homosexual was questioning the validity of this pill or the quality of this pill or what was in this pill. All they knew is that when they were having a few cocktails and doing a few lines, they could take this pill and get laid. But they have 80,000 questions about this vaccine. They don't know what's in it, but they have no problem snorting a line off the side table of a room in a bathhouse that probably hasn't been cleaned since 1973. So we do need to take this vaccine, and I'm going to tell you why. It's not necessarily for us. And yes, there are going to be people who have reactions to it, just like there is the flu vaccination. So the first sort of conspiracy theory that came out recently was in England. They said people were experiencing Bell's palsy. Well, if that was the case, every media outlet in the world, from CNN to New York Times to the Post to ABC News, would have people that had Bell's palsy, and people were saying, oh, well, they're being held in captive because they're being offered money to keep their mouths shut. Well, you can't just hold somebody with Bell's palsy captive underground. They need regular medical attention because it can progress and become worse, and it can actually start to affect your lungs if you don't watch what's happening, because it starts with the nerves in your face and works downwards if it's not watched medically. So that's the first sort of fallacy. The second sort of fallacy is that they're trying to microchip you. Well, you know what, girl? The phone that we're on right now doing this, they've already microchipped us. So we're already past that.
Mm-hmm.
The second thing is we don't always take it for ourselves. We take flu shots and everything else to prevent us from passing it on to vulnerable people. So when they got these vaccines into the country, the first people they're going after are the older, are the people in the senior cares home that have been hit the hardest, and rightfully so. Next, they're doing medical care. So I'll be in the second round. Now, I want mine by February because I have a trip planned to Florida and I don't want to miss it. I've been stuck in this country with no traveling for a year.
Okay.
So,
go ahead.
Yeah. So, but I'm not going to say you have to take the vaccine. That is up to you. I look at people who don't get flu shots and I go, you know, I didn't get the flu shot one year. I got H1N1 and I was literally dying on my couch for 3 weeks. I'll never make that mistake again. And when I get the flu shot, yeah, I still get the flu in the winter, but I have it for a couple of days and I don't feel like I'm going to die. But more importantly, I've probably prevented myself from giving it to a client that I'm working with, right? So I think it's important, you know, they just recently busted 7 gay guys in Vancouver who overdosed on drugs in an apartment in the gay village. And you know, we have COVID restrictions right now. And so it looks like our community is not abiding by these rules. And so what they're doing is instead of having a circuit party in Toronto, they're having a circuit party in Mexico where there's no stipulations. Or now Florida has had no regulations for a month. One of my dear friends, Matthew Glazer, just texted me today and said there's been 13,000 new positive cases in Florida. So whatever they're doing is not working, and it's putting more and more people at risk, particularly in the Wilton Manors community. They said that Wilton Manors had 2,700 positive tests yesterday in people over the age of 50. So that to me is concerning. It's alarming. And we need to get this vaccine. And doctors, regardless of what their personal beliefs are around it, doctors need to encourage their patients to take it, regardless of this RNA that's in it, because there's lots of things that they create, you know, can create side effects in all the other vaccinations. There was a meme that went out yesterday and said, do you remember that time you had polio? No, you didn't, because you got a vaccine when you were a kid. And so you didn't never have it. Well, this is the same thing. You know, people are like, oh, diseases come out all the time. Not diseases that fucking wipe out the amount of people that have happened in the last year. And so we, you know, and regardless of the age or not, you know, people don't want to lose their parents, even if they're 85 or 86 or 93. People don't want to see their grandparents die. And, you know, we have people who go, oh, they've already lived their life. Oh, you know, they're already dying anyways. They're already vulnerable anyways. Well, no, shut up, right? Like, that's not how it goes. So let's get everybody, you know, I'm pro-vaccination, but I'm also pro-awareness, which means if you don't want to take it for whatever reason, that is fine. But when you show up to the airport to fly out and the airline says you don't have proof of your COVID vaccination, you can't fly, because Australia Airlines are making that mandatory once now the vaccine's there. If you don't have a vaccine, Qantas will not fly you. And the government has says they support that and they back that up, and they will hear no human rights case, because this isn't a human rights case. You don't get to go to human rights and say that you've been marginalized because you're not allowed to put other people at risk. So that's where I'm at with the vaccine. Am I going to take the vaccine? Yes, I'm going to take it. Why? Because I'd prefer, if I did get COVID, that it not fucking drag me to the 7th level of hell and back. And more importantly, because I work with some of the most vulnerable people on the West Coast.
Okay. Now, my take on all of this is it's simple. As an older person in the community, and as a person that's an entertainer, I do believe that I'm at risk for all kinds of things. So I will be taking the vaccine. And I think many people in our community should take the vaccine because it's very important for our community, which is marginalized in so many ways, but that's no excuse for them not to take the vaccine. The real issue of this is that we all need to be safe. So if the vaccine is our first line of defense, that's what we should do. And also, the reason I'm having the show is because I really want to make sure that our community, LGBT Two-Spirit pronoun community, is not left out. And somewhere along the line, we are in line for the vaccine. And I understand that we're all Canadian and we're all in the country and we're all in this together. But we also have to understand that the most vulnerable, which is the seniors and the people that have compromised immune systems and children or whoever, should be taking these vaccines if that is the way the doctors feel that we should go. Now, Chadwych, where do you think this virus came from?
Funny you ask that, because I was actually looking over the past series of viruses that we've been hit with, and I went as far back as smallpox. And I said, well, smallpox was a big thing prior to, like, after the 1918 Spanish flu pandemic. So this is our next pandemic since then. Well, let's see, as Chad mentioned earlier, there was H1N1, there was Ebola, Zika virus, MERS,
SARS,
and furthermore. But I'm looking at COVID seems like it's going to be here for the long haul. And I wanted to compare it with a virus that we all know. So I attacked HIV. It's been in the spotlight for 40 years. Next year, May, it'll be 40 years old. And while I was doing that, I'm looking at the way we as a society of gays, lesbians, youth, transgender, everything, how we behave to something that gets thrown at us. And I actually had to search hard for this. This is the original Morbidity and Mortality Weekly Report of the 5 gay men that were dying of AIDS in Los Angeles.
Oh, they were the first ones talked about in The Band Plays On. I remember. Where
5 were mentioned. They went to Dr. Michael Gottlieb. Yeah. And he said, okay, they don't know each other. They've never slept with each other. But yet, out of the 5 of them, one had Hodgkin's, and he was doing quite well. So told he was cancer-free. Why is it that all 5 of them had pneumocystis pneumonia, Kaposi sarcoma, cytomegalovirus, had thrush? Something is new going on, and they had to send out to the CDC for requests for pentamidine. Well, if PCP is so rare, why is it happening now in San Francisco and New York? So that's where I'm talking about the fear of, oh my God, what's going on in our community? Because that kind of fear wasn't there with Zika virus. It wasn't there with H1N1 because it was a more global thing. It wasn't targeted to the gay community. Mm-hmm. So I'm doing a comparison because I'm looking at how do we in LGBT community, how do we behave when bad news is thrown at us? Well, let's see. With HIV, we didn't know the virus, that was a virus until 2 years after it was killing our community. It started reporting, that piece of paper was printed in May 5th of 1981. So they went back and said, has anybody seen patients about this and this and this? It turns out they did from the 70s, but our community wasn't dying from it until 1981. So it was already in the works. So I accept the fact that HIV did what it did because we did not know what caused it. And when we found the virus 2 years later, we still had no treatment. So it was continuing to kill people until the first treatment came out. Now let's get back to COVID. I would say shame on us as a community, as a society. We knew about COVID before it got here. We knew what we saw on CNN and what it was doing to people, killing people. It's airborne. When we got the first case in Canada and the United States, we should have put masks on immediately. We shouldn't have to be told to do that because we had enough warning. We saw it on TV. We didn't get that chance with HIV.
Okay. Chad, do you think that COVID is part of SARS?
Yes, it's because, well, it's called COVID, what's called SARS-CoV-2. That's the virus that causes COVID-19. SARS-CoV-2 is the HIV thing. COVID-19 is the AIDS result. The virus causes the disease. So when people say I'm getting tested for COVID-19, you're getting tested for the disease that's caused by the SARS-CoV-2 virus. I looked into a lot of these things because I want to know. I have a pre-existing medical condition. I take immunosuppressive drugs to knock down my immune system. I'm the complete opposite of an AIDS patient, but I'm immunosuppressed. If I get that vaccine, which I want to do because I want to protect myself and people I'm surrounded by, am I actually hurting myself by trying to protect myself?
Exactly.
Now, once again,
do I have to kill myself by trying to protect the community? And that's my only fear.
Now, can I just ask you again, where do you think this virus came from?
I think it came from Asia. I think it came from, well, they say it came from Wuhan, from the wet market. But I also found out that the viral lab is, 20 miles down the road.
I can't hear you.
You can't hear me?
I don't know if it's me.
I can hear you guys just fine.
I think your mute button is on again, Steph.
Huh?
The mute button. Can you hear me?
I can hear you guys fine.
No, it's not me. Okay.
No,
Check your mute.
Can you hear me?
Yep.
Yeah.
Okay. Now, so what were you saying now? Where do you think the virus came from?
Me or Chadwick?
Chadwick.
I think it came from Southeast Asia, just like swine flu, which got renamed to H1N1. And I don't know, like all this conspiracy talk, this guy ate a bat. I thought, wait a second. People have been eating bats for hundreds of years. Why would coronavirus finally start killing us now when it's been done for so long? I think the virus escaped them by accident and they blamed it on people eating bats, just a cover up. Now, whether it was intentional or an accident, it doesn't matter. The fire is burning, whether it was whether it's arson or was an accident. So now that the virus is here, never mind where it came from. What are we going to do about it? Because here's what it's doing to us. If we don't find a way to stop it, its job is to kill us. Our job is to make sure it doesn't.
And that's the thing is in China, Japan, they immediately started wearing masks right off the bat. It was mandated by both governments. But what I don't like is the Chinese government concealed the fact that this was going on in their country when it was happening. They knew that people were leaving their country even though they were extremely sick and leaving their regions even though they were extremely sick. And then when it finally landed in North America, the first thing they did was, like you said, they blamed it on bat soup. But you know what? Those bats are cooked. It's boiled soup.
Exactly.
So
the virus is dead.
Right. So I believe that somebody fucked up in one of their labs. But I also knew that they were prepared for this because they opened a COVID hospital in Shanghai, and then they claimed to have built it in 4 days. You cannot build an 8-level building in 4 days, even if you worked 24 hours around the clock. The foundation on the bottom floor wouldn't have set by then. Like, there are so many things that people are not looking at. And, I'm not racially profiling China. And yeah, the last 4 or 5 major viruses have come out of there. And that is because they do have a horrible pollution issue over there, which does help create viruses. They also don't have the control with their food prep. And I know because I've been there. I had to live at McDonald's the 2 weeks I was there because I just was I was not doing the restaurants. I just could not. I'd walk in and I saw what was going down and I was like, there's rats on the floor. I would fucking leave. Because to what they view as normal is considered faux pas here. If there were rats on your floor in the restaurant in Canada, you would be shut down and humiliated in the media. But there, they just picked them up and they're like, well, more livestock because they live off their land there. They eat, they eat. They
look at the quality of what the lifestyle of different parts of the world. There they eat bats. In Africa, they eat monkeys. They eat all these wild things, and they call it bush meat. Now, Viruses coming from those animals, they're live when the animal is alive. You cut that animal, kill it just like a chicken, and guess what? You get a cut, their blood goes in. Okay, that's the human transmission. Now, when it takes one human being from chopping up meat that's infected with a live virus and it went into your bloodstream, you go home, have sex with your wife, your girlfriend, your mistress, whatever. Now you can pass it on to the rest of the world.
And there's also the world GRD scale that we need to look at. So last year, prior to COVID, China accounted for 8% of the international financial GRD. Now they are at 25%. They have capitalized on this virus because they're the ones that are building all the masks. They're the ones that are building all the PPE suits and selling them to other countries. And so this is why I'm really thankful that Trump didn't get in for a second term, because I think had Trump got in for a second term, he would have bombed China, even if people told him not to do it. And any Asian country that sends bombs over to the United States, they come over Canada first. So I was more than, like when he was fighting with North Korea and all that, but like, it's not about him fighting with John Yu Kim or whatever, but like, it is important to realize that like people need to not look at this as a reason to penalize China as a country. This is not, like the racism that has come out of, this is exactly like SARS, severe Asian racism syndrome. And, this is not, the violence that is happening to third and fourth generation, like Canadians who are of Chinese descent. And, like I had, my coworker had to take a leave of absence. His father, who has mental health issues, actually assaulted a 92-year-old Chinese guy in a store during the first wave. And so he took leave because the embarrassment that came from the newspapers, even though he's estranged from his father, he was still getting threatening messages on Facebook for his father doing this racial act. So it's really brought a lot of people out in favor of, racially colonizing Asian people in North America. And that's not what this is about. If you want to say the lab where it came from in Wuhan needs to be shut down, or we're going to bomb that lab, fine, bomb that lab. It probably has been responsible for the last 4 major viruses that have gotten out. And, so bomb it. But the conversation that we're having today, and we're talking about China, and we're saying, we don't necessarily think it, the bad soup thing is a really horrible, it's a microaggressive like Asian explanation, and it was only sensationalized by Trump calling it the China flu, the China virus, the Wuhan virus, whatever. He never, ever called it its legitimate scientific name. And so these are the things that increased incidents of racism, not just in the United States, but in Canada. Yep. And so it's important for us to realize that, like, we cannot hold the entire Chinese population responsible for COVID. It's just, it's insane. It's like, when Hitler held all the Jews responsible for, the suffering of poor people in Germany, even though they had worked really hard for what they had, it's the same sort of thing. And I'm sure people in China are just as concerned about their well-being as we are in North America. I mean, they have to send their kids to school. They have to go to work. They have to walk on the streets. They don't know if the person beside them on the public transit has it. They're going through the exact same things that we are going through. And it's, governments as a whole, like the only people that I found held, really, really took accountability for the betterment of their countries during this was the Prime Minister of New Zealand. She shut her country down, right down. She took heat right, left, and center. She gave zero fucks about what her constituents said. She said, you voted me in to run this country. I'm running this country. I'm listening to our medical health professionals. And they literally maybe had like, they literally had like maybe 1% of all the cases, and they've had no positive tests since then because they shut everything down. And same with Japan. Japan has had a low sort of like, they had one area where there was an excessive amount of tests. They wouldn't let people out of that area, and they masked everybody else around the country, and it finally stopped. And now in the lower mainland, in Vancouver, which is connected to Richmond, and Richmond is famous because that's where most people who've immigrated from China live. Out of all of the cities in the lower mainland, in the Vancouver surrounding area, Richmond has the lowest amount of tests. So people who are saying that it's Asian people's responsibility, well, how come Richmond has the lowest amount of tests out of all the lower mainland? And that is because they, as a community, went, we don't want this. It's going to bring a lot of damage. They started masking up in Richmond immediately. The mayor was encouraging it. They did everything. And yes, they have had tests, but nothing like Abbotsford, BC, and nothing like Vancouver. And so so I think it's important for us to realize that this isn't about us attacking Chinese people or saying that they're responsible for what's happening, but rather to remove the stigma of where this virus came from, because now that it's here, it's everybody's problem.
Exactly. Because like I said, you go into a room and you're talking to people, you've signed a death sentence for them just by being in that room. Other viruses, they all have their different ways, but this one, how much easier is it to spread other than it's like chickenpox? Just stay in the room with somebody, you're infected.
Mm-hmm. Yeah. Now, and do you not remember when we were kids? If one of our friends had chickenpox, our moms would send us all over to go hang out. And if COVID wasn't so sketchy, I would probably make if it was just simply you got it and you were sick for a week and then you were fine and there was no risk of death, I would send my kids over to get it just so it would be done and over with. And sadly, we can't do that with this virus because we don't know who it affects everybody differently. Well, and I've had friends that have had it. I had a friend who had 0 symptoms, sat at home for 2 weeks, repainted his place and bought a PlayStation and learned how to play video games. And then I had another friend who was sicker than a dog for 10 days. Everybody's different.
Okay, so as a community, let's go back to Stephanie's question. Where do we see things going with this virus? With not even the virus or the vaccine, I've noticed a big change in the way how people behave from LGBT from the pandemic started until now. And I'm not sure if
bitches.
The way how it works in Toronto, I don't know, but in London, when we were on the first couple of weeks, we were all edgy. We're online because this was our outlet. And people that were the top of everything, drag queen, entertainers, you think, oh, they got their stuff made. Like they're the top, they're the bomb. And they had vulnerable spots that we didn't know about until COVID hit. And then those vulnerable spots got exposed. The average everyday person, I just thought, oh gosh, this pandemic's gonna wear that person out because they weren't doing very much anyway. So wrong. They got tough and made it. So everything I thought about people was a complete opposite of what they really were. And the depression, anxiety, the suicide rate, the divorce rate, COVID has done a number on us. So if you were wondering, where does it go with the gay community? I don't think it's where it's going. Where are we coming from as a community first, and then throw COVID in the picture? I think it's going to reshape us in the way how we do things, starting with mask up. So I hope that answers your question, Stephanie.
Mm-hmm. Now, I want to talk about I take my wig off, I say this all the time, to the essential workers and to the people that are protecting us and keeping things moving along. Now, it seems strange to me that so many of the elderly people are testing positive, but the nurses and doctors who are taking care of them are not.
Mm-hmm. Oh, so I will tell you why. It's a sad reality. Visiting has been cut off since March in the senior cares homes. And so, but the staff have not been following rules. So it's actually the staff that bring it in. And the reason why I work in healthcare. I've been exposed, I've been around people who've been positive for COVID. And it's because older people are not always as we got older, we were more aware of, oh, you know what, keep your hands clean, use some hand sanitizer, you know, even before COVID, right? And like older people, like, you know, they just go through their day and, you know, they wash their hands in the morning and then they do it at night, or they do it at dinner before they eat. So they're not always, you know, they don't always go to the sink. And so what I find is that it's because healthcare workers coming in to work were visiting with their clients without wearing masks. Mm-hmm. That's something that they found was happening in a few of the care homes in Canada. So like my office has like plastic around it. So I don't always wear a mask when I'm in my office if I'm by myself. But even when with that plastic, when I'm talking to somebody, because there's little holes in where they talk, I literally put my mask down for that. And so doctors and nurses, because I work with them directly, I mean, they are removing their plastic gloves after dealing with each patient. They're hand sanitizing, they're being sprayed with sanitizer around their stuff. Like, you know, like it's really, really become a vigilant thing. Our temperatures are taken every day before we go to work. Our temperatures get taken halfway through our shift. And then again, when we leave, they take our temperature on the way out. And if there's any variance in that, any weird variance, it's documented and we're usually pulled off. I think I've been tested 4 times since March, just based on, you know, who I had interacted with throughout the week and what was decided by the health, like our health authority who's in charge of us. So they'll send you a letter being like, you were with patient blah, blah, blah. We really think that you need to get a swab done. And let me tell you, that swab is no fucking joke. And it fucking hurts. It's the worst thing in the world. I mean, it's a thin Q-tip and it goes right up to here. And it's the most uncomfortable thing. And water comes down your eyes. You could film the greatest love scene if you got that, you know, like it's something else. And so, I just think that you know, it is airborne, but it's also from touch and touching surfaces and stuff like that, because there have been people who've been like, I've been around nobody, but I touch public doors. So
the dirtiest thing.
Okay, so Chad, now Chadwick, now the frontline workers, now how important do you think that is?
It's very important.
How important do you think the frontline workers are?
Well, first of all, let's talk about healthcare people in general. I think in 2020, it's very shameful that healthcare workers are not getting the respect that they deserve. You know, they're trying to protect the general public. They're taking in all sorts of people. They're already at capacity before COVID, and COVID threw them over the limit. They get off work. You see the marks on their face from that mask all day long, and they go to the grocery store, and people are arguing, I don't want to wear a mask. It's against my constitutional rights. And you have a doctor or a nurse healthcare worker going in to get groceries. I just took care of all these patients. 3 of them died on my shift, and here you're protesting a mask and all that. So all that time and effort it takes just to become a doctor, just to have the letters PhD behind your name, and then all the studying and clinical trials trying to come up with something to protect people. I took an oath, promised to do no harm. That's what they're doing. And all these people are saying, I'm not doing what the doctor said. You can't tell me what goes in my butt. Okay.
I put up with more abuse at work this last year than I ever have in 8 years. I'm not, like, you can do nothing right. You can do nothing right at all. Everything's wrong, you know.
And you just have to take it like a grain of salt. But at the same time, I don't think it's fair that people who work in healthcare should have to put up with that kind of abuse just because they went to work. It's not.
Are you in health, Chadwick?
What?
Are you in healthcare, Chadwick?
No. I get treated by healthcare. I'm a frequent visitor of the hospital. I should be getting air miles for all of my damn visits because I get a free trip by now. I have. Hold on a second. Hold on. Let me just show you this.
So,
welcome to my life.
Oh.
Now, let me just ask now. I want to go back to our community in a
Yeah.
sense. Who do you think should be vaccinated first in our
People
community
with
there,
HIV first.
Chad?
People with HIV need to be vaccinated first. You know, people are susceptible from passing over from that HIV positive status to full-blown AIDS with a pneumonia-based virus. The problem is there are some people who are HIV positive who are gonna, you know, there are people who live with that virus and never experience any difficulties for fucking decades. So like, there's gonna be some that'll probably be like, oh, I've got a nasty cold. But then you're going to see those other ones who are dropping into fucking Casey House. And, you know, like, so it's important that they do deal with the immunosuppressed first. They need to deal with the street involved members of our community, the marginalized people, along with the HIV, you know, get the people that are exposed to the most.
But they're in categories now because, see, like you said, people like after the seniors and the healthcare providers, HIV positive, yes, that's true. Organ transplants, you're immunocompromised. Me,
yeah.
I have an autoimmune disease, but I'm immunocompromised from medication. We're all in that immunocompromised group. So even though my HIV status is negative, I'm not in the clear. Last year, I was starting to develop a pneumocystis-like pneumonia. And I thought, what the heck? They did the scan and they said, I have pleuritis, and it looks like there was like a fungal, like a yeast infection developing.
So let me clarify. Anybody who's immunocompromised in our community needs to be vaccinated, right? I'm priority for vaccination because I'm in healthcare, and so, you know, I'm waiting to get that call to, you know, your vaccine's ready, come get it. We need to also deal with our aging population in the gay community. I believe that, you know, there's a number of senior groups that meet at the 519. I believe that would be, you know, something that needs to be looked at. I don't believe some 34-year-old who goes out and parties every fucking weekend of their life, and the reason why they want that vaccine is so their social life can get back on in order. I don't believe that that's a priority when it comes to vaccination reasons.
They will do that.
Now,
so
go ahead.
So I think it needs to work just like it does in outside of the gay community, is that, you know, old people with immune compromised systems, you know, people that are dealing with people in human service jobs, and then the rest of the people after that, right?
Well, you know, I like I said before, is we're all very lucky that people have to work, and the essential workers have to go to work to take care of their families and pay their bills and stuff like this. And for us people that are in certain situations, whatever it may be, we are lucky that those people put their lives at risk every day just to make sure that their families are okay as far as their bills go. And financially, they understand that they need to work to sort of keep food on the table. And sometimes we have to take the risk to just make sure that we're going to be okay. We understand that we're in a pandemic, and some of us are just very lucky that the healthy people are trying to look after us. And we're very lucky in that sense. And mainly in Canada, we're really lucky because the government really does try to look after its citizens and other people that live here in the country. Now, I just want to say this, because I want to close it, because I think that we've hit a lot of the key points already. But I just want to ask the two of you, where do we go from here?
Good question. I was going to ask me that. Before where do we go? We need to know where we're coming from. We're coming from a lot of stubborn people that don't want to follow the rules, which means they're going to take us into lockdown. When we start going by the rules, do what we're told, even if it doesn't work, follow the rules. It will get better if you cooperate. It just treat this virus like a police officer handcuffing you. You're under arrest for whatever reason. Well, guess what? The more you move around, the more it's going to hurt you. But just cooperate. That's what you need.
Okay. Now, Chad, do you think the government's handling of all of this has been good?
No.
I think it's not
Okay.
the best,
We're-
but we're doing.
Do I think that Justin Trudeau has failed to the level of Donald Trump? No, I don't.
No.
But the problem is that Trudeau, after the first lockdown, left it up to provincial, like the provinces, to have their premiers. Look after it. So Alberta is an example of what happens when you have poor leadership involved, and I don't care. Jason Kenney's an idiot. I mean, he grew up 10 minutes from my parents' house, and he has always not been smart. But he hid reports from Alberta medical experts, and as a result of that, I can't go home for Christmas to my family's next weekend because Alberta is completely locked down. Did it have to get to that? No. They started to have a problem, a surge of tests. About 5 months ago is when their red alert started, and he did nothing to stop it. He shut nothing down. And then finally the medical specialists came forward and said, we gave him these reports. He ignored them. He hid them from the public, whatever. And, each province has had John Horgan has done a very good job despite the difficulties of, we've had some really, really intense areas of British Columbia.
Never mind.
Yeah. I find that if there's an NDP government involved provincially in the provinces, then it's actually been proactive in, we had the most relaxed restrictions in the country because at one time we barely had any tests compared to the rest of the country. And then out of nowhere, one weekend we had first it was 3,000 one weekend, and then it was 2,000 the following weekend. And then before you know it, there was 9,000 throughout the week. And, it became this real serious concern. And so now our mandates are wearing masks. It's mandatory for you to be in a mask in any public space. If you're found to not be wearing a mask, the people in the store can phone the police. You will be fined. They can only allow 10 people in a gym at a time, and they have to have strict COVID policies and things marked out. Masks have to be worn all the time. They've shut down schools because it was starting to spread in our schools like a wildfire. And so they shut down our schools, and now kids are going online. And there's also, and this is going on until January 8th. And, it's already extended they started it middle of November and said on January 7th, we'll revisit. Horgan literally said, I'm sorry to tell you, Christmas is canceled. So there's no non-essential travel allowed in BC. So there's, a lot of people are going to have a rough Christmas. I mean, it's the reality of, people thinking that it's going to go away. People thinking that it's just, that it's only a certain group of people that are getting it. It's a lot of people that relied on assumption instead of medical science. And so this is where, unfortunately, we're at as a country. Now, Justin Trudeau came out every day and said, these are the things that I'm trying to assist with. He does his COVID updates every day. I think he still does them. I don't think you need to do an update every day. I think that once a week, you should probably address your country about it. And, and you should be proactively working with your committees to figure out how to get rid of this virus, how to come up with the money to pay for the vaccines that are going to come in this country, and not be talking to the public about what you're trying to do. So, I mean, he didn't do what Donald Trump did. I mean, Donald Trump he treated this virus like a joke. I don't actually think that Donald Trump actually had COVID. And no. An overweight man asthmatic man in his 70s kicks it in 4 days with steroids. Get real. Um, and if you believed him, then, you know, you should be allowed to vote. It's
Okay,
you
let's
know,
just let's do this. Because I want to wrap it up because I think we hit the points already. Now, I want to talk about the community itself. Now, you know, usually the gay community is usually the first ones to get hit with any strain of anything.
Yeah.
And maybe it was good that the communities were shut down, such as the bathhouses and, you know, certain
but
places
it didn't hit us
that our
like we
community is
thought it would.
Wait a minute, hold
known
on.
to visit
Yes, it did.
and do
Wait a minute.
kind of, you know how we are.
Vegas had no desire to treat AIDS because it's only happening to those gay people. It's just those people. Oh, it's happening to IV drug users. Oh, they're just like the gays. What about the Haitians? Oh, they're black from a third world country. Oh, wait a second. It's happening to hemophiliacs. Wait a second. This is serious. My baby blue-eyed boy is a hemophiliac. Well, we got the money to pay for it. We're rich. So now it's serious when it's happening to a hemophiliac. But Rock Hudson, gay man, he's gay. Who cares? IV drug user. Well, if you didn't do drugs, that wouldn't happen. Who cares? You're a black person from the Caribbean. Who cares? Hemophiliac. Oh, this is a serious disease.
The reason why COVID is getting the press that it's getting is because it has killed older people and young kids. If it was just killing regular adults on a daily basis, nobody would care. Oh. So trust me, the media has, you know, like, there are aspects of this disease that I think have been over dramatized by our media.
Mm-hmm.
I think it's important to know that it is a contagious disease and you can pick it up by coming into contact with somebody. But I worked with a person for 1 week who had COVID and didn't know it for the week that we worked together. And I just didn't, I got put in quarantine, I got tested, and I didn't pick it up. So the whole, it's super contractable, sort of lost its appeal with me, because here's this guy, my desk is here, his is here, and our faces are like here. Mm-hmm. And so if that's the case, we worked together for 5 days in a row before he started to feel unwell and got tested. So we're in this enclosed office together, and I'm not saying that, you know, I'm a prime candidate for COVID, but like, if it's that readily to, like, it's that readable to get, how did that not happen to me? Right? Like, maybe I got the luck of the draw. Maybe it was luck.
What are the symptoms of COVID? What are the symptoms?
So
I was watching Ellen the other day, and she was saying that she didn't know she was having back problems, and she didn't know that COVID
my coworker had no symptoms. He's like, yeah, and he's like, on Saturday, I felt like I had a sore throat for about 20 seconds, and he goes, and then I noticed I couldn't taste my food. So, like, we worked together Monday to Friday. Saturday, he didn't feel well, couldn't taste his food. He got tested on the Monday. By the time he got tested, he had a snotty nose. So they were like, you need to stay home anyway. And then he had the result the next day.
Mm-hmm. Now, okay, so what we're going to do is we're going to wrap it up. I just want to say that, you know, hopefully, we want to just say thank you to the frontline workers. And Chad, you're in the healthcare business. So thank you for doing what you do. And thank you for being a friend.
Problem.
And thank you, Chad, Chadwick Chung, for your insight on information. And the mere fact that I just wanted to have this conversation for us and for our community, just so we understand that we are concerned about what's happening in our community and what's going on with us, because it seems that nobody else is talking about what's happening with the COVID-19 vaccine and us. So I thought I'd bring some light on it, because we should have this discussion, and we should, even though we're in line with everybody else, we just want to make sure that they don't forget about us, and to protect, you know, the homeless population, and the fact of the LGBTQ community that usually gets swept under the rug most of the time. Mm-hmm. Unless it's something really concerning, or like they think that we have done. And I want to, you know, and like you said earlier, Chad, we can't sort of blame one country, but somebody has to be held responsible for shutting the world down and putting us in a situation that is very concerning for all of us. And now that we might not know which way to go or how all this is going to unfold, but hopefully the vaccine will give us some sort of light for us to go back to our normal lives in a sense, but with precautionary measures that we probably should have been taking in the first place. Mm-hmm. And I want to say thank you to you two guys for coming on and
well, thank you for having me today. I really appreciated it. Merry Christmas. And remember, for those that are watching, Christmas is a tough time. Please reach out to the 519 Community Center to access resources. If you're suffering from depression or you feel like you need somebody to talk to, they have access to 24-hour lines for you to call that can help you get through those tough times. Christmas is going to be tough for everybody, especially people that can't travel, but more importantly in our community, for people who have been disowned or abandoned by their families, please reach out to that center, get the help you need. You don't have to sit there home alone, and you don't need to think that that's the last day of your life. So please reach out.
Okay, so Chad was very clear on reaching out, making sure that you say hello to your neighbors, to your friends, even if you're just doing video chat or you're making a phone call or you're just sending a text. And I just want to say thank you to you two gentlemen for a lovely conversation. You were very insightful there, Chad Conley. Thank you, sir.
You're welcome.
And Chadwick Chung, thank you for the information part and expressing your views. And my views is that I just want to make sure that our community, LGBT Two-Spirit pronoun community, is not left out of the conversation. So thank you guys. Merry Christmas and happy holidays. And we will chat again, gentlemen.
Absolutely. Till next time, take care.
Take care. Bye-bye.